All right, welcome to the quick reference video to introduce the clinical assignment in psychiatry. The goal of this video is to walk you through the instructions, to clarify what's expected of you, and to hopefully answer some frequently asked questions. So as you can see here, I'm on page 66 and 67 of your course manual. All the instructions can be found in your course manual between page 66 and 69. The main goal of the assignment is for you to demonstrate your ability to develop a nursing care plan for a patient experiencing a mental health crisis. So it is really an account of your nursing care on one particular day of your clinical rotation. Okay, so this assignment can be presented in a variety of formats. It can be a written paper, a live oral presentation in pre-conference or post-conference. The length of that presentation would be about 15 minutes, or a pre-recorded audio or video presentation. Again, same length, 15 minutes. So let's start from the beginning so we can start tackling this project, which is due next week. Please check your class schedule. It's marked on your class schedule and confirm with your clinical instructor. So you have to select a patient next week, either on Tuesday or Wednesday, confirm your selection with your clinical instructor, and then let them know what's your preferred format. Are you going to submit a paper or are you going to give an oral presentation? Now, the main components of the psychiatry assignment are four. So the first part is your patient or client profile, which is your assessment data. So that assessment data includes an introduction of your patient, so their bio data, their psychosocial, some psychosocial assessments, lifestyle factors, and your MSc findings. So that's the patient profile, and there's a template for it that we're going to go over in a bit. The next part is the nursing care plan, which is a table actually, and it's very nifty because it will help you organize your thinking and your nursing process. And we're going to talk about it in a bit. The last two parts are the medication therapy and personal reflection. So the medication therapy section is a short discussion of the key psychiatric medications your patient is on, related to the diagnosis, right? So, for example, if your patient is admitted with MDD, major depressive disorder, I expect to see an antidepressant or even an SSRI in this section, and a discussion of, well, really a list of the name of the medication, generic and trade, mechanism of action, and all the little details that are in the parentheses here, right? Some desired or anticipated effect on your patient, etc. The last thing that we want you to comment on is if you think the medications are helping the symptoms. So is the pharmacotherapy helping? Has it achieved desired effect yet? Does the patient have history of adherence in the past? That's also something that's common in psychiatry and worth assessing. Finally, the personal reflection invites you to engage in a self-reflective exercise. And we ask you to choose one of the three questions that are right here. Pick one that speaks to you, reflect on it, and respond. So in written format, it would be maximum 200 words, double spaced. And an example of a question in the personal self-reflection is this: what did I learn from this experience with this patient? And this experience meaning caring for this patient today. How can I use what I learned from this experience to improve my patient care in the future? So if that one speaks to you, grab it and run with it. You have two other options if this one's not, very enticing. For the students who are doing the oral component, Yes, you must include a personal reflection in the oral section. I was going to talk about references now, but I think I'm going to touch on it in a bit when we go through the template. So let's do that now. And I have a zillion things open on my desktop, so bear with me. But here we are. Here is the template. This is going to be posted on Leah. In fact, it already is. And you can grab this document and fill it as you go. So, so the first part is your patient profile, right? So all your patient's information, the basic information that we need to take care of them safely. And then we get into the psychosocial aspects like housing, what their financial status is like. I'm not really going to read everything here. I'm just scrolling down quickly. I'll let you read. If you have any questions, please ask myself, Fanny. You can mail me, or you can ask your clinical teacher. They'll be more than happy to answer. So yeah, the biopsychosocial data. The final aspect of the patient profile is putting in your mental status examination findings. So the data, right? The findings of your assessment. You can use this table. All you need to do is just fill it in. The only thing I ask of you is to fill it in as if you were charting on the patient, right? So as you have it here in the example, patient is well groomed, et cetera, et cetera, et cetera. Okay, so all the main components are listed for you. You just need to make sure you fill them in. Now, the patient profile part is done. The next part is your care plan. So you're expected to select 2 priority problems. You'll notice that in the course manual, I think it says 3. I've amended it to 2 problems. I found that 3 was excessive, so we're going to stick with 2 priority problems, and this is going to be reflected in the rubric that the teachers are going to use to grade your assignment. So I provided an example here on a fictitious patient, Mrs. SF, who's diagnosed with schizophrenia and admitted for decompensated schizophrenia. So the first problem for her is malnutrition related to active auditory hallucinations, telling patient to fast or not to eat. So you see that I've worded it in the format of a nursing diagnosis. This is not necessary. You can keep this if you feel comfortable, or you can simply name the problem. Alternatively, you could have said malnutrition. Okay, so that would have been A-okay. Now you want to support your selection of the priority problem with some supporting data. In this case, we have a cluster. We have at least, well, we have 3 right here. Active auditory hallucinations telling patient to fast. And in this case, you could include your entire assessment with regards to auditory hallucinations. So the intensity, the frequency, the triggers, like all that. Second piece of data is weight loss. So the patient lost 15 pounds prior to admission. And then the last piece of data is the patient was noted mumbling in the hallway instead of having a meal in common room, right? And this is an observation from the nurse. The short-term goal is patient will eat full meals, including breakfast and lunch during the shift. We're keeping the goals short-term, just one within the 8-hour shift that you were taking care of your patient. In terms of the rationale here, I kind of skipped it. I forgot to mention it. The point of the rationale is to justify your choice of the priority problem and to prove it to your reader or your teacher, right? So in this case, the patient's illness has decompensated to the point where the patient cannot meet their daily nutritional needs. They're currently malnourished and they need admission, right? So this is why I'm choosing this malnutrition as a priority problem. Next, we have 2 nursing interventions, and you're required to have at least 2. and a combination of pharmacological and non-pharmacological, please. You can see here, pharmacological is administering the patient's regular atypical antipsychotic with a reference, please. And the second one is a non-pharmacological, so it's more of a nursing intervention. It's an education and or I guess encouraging patient to perform self-care activities to distract her from the auditory hallucinations. Okay, notice that it's individualized, the self-care activity for Mrs. SF. It includes talking to her friend on the unit or listening to her favorite genre of music, Afro beats. So there's that extra personalization, and we're looking for that. It tells us that you know the patient, right? And that you're individualizing your care. So let's talk about references. We expect that the nursing interventions are cited so that they should be sourced from the textbook. They should be sourced from, Nursing Reference Center Plus, any online reputable source. And the format is APA. All right. If you need any details or you're wondering what and how to do this, the Vanier College Library website has a variety of videos and PDFs with guidelines on how to achieve APA format. Okay, so at the end of your written assignment, for those of you who are submitting a written assignment, there should be a reference list. Okay, so as I'm scrolling down, you see there's this like sample reference list, and it's following APA formatting, and it's only for your interventions. Okay, so that's done. Then the last, well, almost last part, we're almost there, is the evaluation. So did your interventions work? So the ones that you chose, were they effective or not effective? And was your short-term goal met or not met? Okay. I discussed the medication therapy and the personal reflection already, but this is part of the template, so you can, just delete the instructions and type away, and then we're ready to submit. Wonderful. So last thing before I let you go is I wanted to answer a few frequently asked questions. Do I need a reference page? Yes, you do. If you're submitting a written assignment, you need a reference page sourcing your interventions. Now, if you're doing an oral presentation, you do not need to submit any written documentation, like nothing. Just be prepared. If your teacher or classmates ask you to source your interventions, have your references on the side somewhere so you can answer that question. All right. Which leads me to my second question. If I choose the oral presentation format, do I need to hand anything in? No. Just use this template that I went over with you in this video as a guide during your oral. This way we make sure that it's complete and that you cover all the elements of your nursing care plan. Final question. What do I need to do to pass? So this assignment is not graded per se. It's pass or fail, or meets expectations or does not meet expectations. So you will see in the rubric, which is the evaluation tool that we use to grade the assignment, that once you get 60%, it counts for meets expectations. All right, I hope that's clear. Last, do you need a cover page? No, even though we're asking for APA formatting, we can skip the presentation. So the cover page, just start with a template as is and fill it in. You should be fine. Good luck with your assignment. I'll be very happy to hear from you if you have any questions or comments. Okay, bye.